QiShenYiQi Pills, a compound Chinese medicine that attenuates microvascular permeability, ischemia, and reperfusion in rat. Professor Han, please, the floor is yours.
Yes, thank Dr. Dusan for your introduction, and thank Professor Tekura for your invitation. Today I'll talk about the compound Chinese medicine. The name is QiShenYiQi Pills, attenuates the cardiac microvascular hypermobility and endothelial damage induced by ischemia and reperfusion. In China, cardiovascular disease has become an important disease threat to people's health. In 2007, a paper has published in New England Journal of Medicine that reports the PCI did not reduce the ratio of the risk of the day and another major cardiovascular events in patients with stable coronary disease because the PCI induced ischemia and reperfusion injury. The department I'm working in is the Department of Integration of the Chinese and Western Medicine and Tasli Microcirculation Research Center of Peking University Health Center. This research center consisting organ microcirculation laboratory, histology laboratory, and cellular and molecular biolaboratory. Our group has demonstrated the ischemia reperfusion induced cardiac microcirculation disturbance, such as the ischemia reperfusion induced overexpression of the ICAM1 in venular wall in cardiac and induced the swelling of the endothelium. Lots of the Cavolo number increased after reperfusion. The FATC label albumin leakage from the microvessel automatically induced microvessel damage, decreased perfusion of cardiac, increased infraction area after ischemia reperfusion. This renewal has been published in the pharmacology and therapy in the next year. Our group demonstrates during the ischemia, lack of the oxygen, nutrition, or water, which declared the ATP fibrate is the subunit of the ATP syntheside, which induced the ATP degradation, induced affecting this symbol and cardiovascular endothelial cell fibro disruption. However, after reperfusion, lots of the free radical production through the mitochondria in ADPH oxidation in another way, which induced the apoptosis autophagy or activity numerous signaling pathways such as the SERC pathway and the CABA pathway, which induced the release of the inflammation and overexpression of the adhesion molecule such as CD11B and the CD18 in neutrophil, ICAM1 and VCAM1 in endothelium, which induced the leukocytes rolling adhesion to venular wall and the immigration after venular wall induced enhanced tissue injury. Ultimately, the vascular injury induced the water and the albumin leakage induced edema through the microvessel. Here, I want to introduce the theory of the Chinese medicine. This is qi in China, which consists in air and the rice. However, in Japan, this changed, but not rice. This qi produced the ATP through the ATP syntheside. In the vascular endothelial cell, synthesize the ATP it will use the oxygen and the nutrition, which help actin monomers symbol to F-actin. That's because the ATP monomers is higher affinity to monomers actin, which help plus end of the actin fragments, where the ATP actin monomers has a lower affinity to actin fragments, each to 6 of. ATP 10 to ADP that make the ATP explosive, which induce the effect in this symbol and the sodium. The vascular hyperpermeability control by qi through the actin and the tight junction. Qi containing actin integrity and the myocardial structure, driver myocardial contraction and the third promotion blood circulation, blood flow. Therefore, we have hypothesis that qi consisting air in the rice, which produce the ATP through the ATP synthesis. In the heart, qi promoting blood circulation in the blood vessel. Qi can govern body flows in the blood. If some case, such as the ischemia, anoxin, lack of nutrition or loss of the ATP synthesis, may induce the qi deficiency, which enable to driver blood induce the blood stasis, such as microcirculation disturbance, and enable to govern body fluids, induce the thermal and the edema and the hemorrhage. The QiShenYiQi Pills is compound Chinese medicine which consists in ostrogulus. The major compound is AS4, and the Savalium military heat, the major compound is the hydrophenolactic acid, the DLA. The R1 is major compound of the panic ginseng. Firstly, we detect the effects of QiShenYiQi Pills and cardiac ischemia reperfusion injury. The ischemia reperfusion model was established by ligation of right coronary suppurate descending artery for 30 minutes, followed by reperfusion. The QiShenYiQi was given by Gavage 2 hours before the ischemia. The 90 minutes after reperfusion, the expression was performed. The myocardial infarction staining by the TTC compared to the similar and the similar plus QiShenYiQi group, ischemia reperfusion induced the infarction area increased. For treatment with the QiShenYiQi, the dose-dependent manner induced this increase. The ratio of ADP per ATP, AMP per ATP in cardiac tissue was increased after reperfusion. For treatment with the QiShenYiQi and the high dose, inhibited this increase. Next, we detect the ATP 5-day, a subunit of the ATP synthesis in mitochondria, which was decreased after reperfusion. For treatment of CP, QiShenYiQi prevents this decrease. This picture showed change of the histology in myocardial tissue. We can see here, compare the similar group, this red bar indicate the F-actin. The F-actin was broken, disruption after reperfusion. The structure, this picture showing the electron microscopic image. The disruption was broken, and the mitochondria was swollen, and the swelling of the cardiac tissue. And the myocardial fiber was broken. However, pre-treatment with QiShenYiQi can prevent the breaking of the F-actin and the ultrastructure in the myocardial fiber. This slide shows the heart function. In compound with the similar group, we can see the LVSP and plus DP max was decreased. And the LVDP, LVSEDP, and the minus DP minus was increased, indicates the heart dysfunction. However, for treatment with QiShenYiQi, prevent this change. This slide shows the myocardial perfusion, the resulting detected by laser triplet. Compare the similar and the similar plus QiShenYiQi group. After ischemia, the perfusion was decreased. Now treatment, if not treatment, this perfusion now recover after reperfusion. However, for treatment with QiShenYiQi, particularly in the high dose, prevent this decrease. Our study also demonstrates that the QiShenYiQi can prevent ischemia reperfusion-induced cardiac injury and dysfunction. This data not showing this conference has been published in several papers in this year. Our study demonstration that the major compounds of the QiShenYiQi is the DLA can bind into the binding to CERT1 F regulating of the NDUF10 and binding to CERT3. This the binding to CERT3 and operating the NDUF9 and the SDHA. This is subunit of the components 1 and the components 2 in mitochondria. After ischemia reperfusion, the components 1 and the components 2 down-regulated. Therefore, cannot promote electrotrans. However, treatment with the DLA can up this expression. On the other hand, the AS4, which including AS, AB1, AG1, and R1, all of this in Chinese medicine for tonifin qi integration, all of this up regulating the ATP5 subunit of the ATP synthesized. The QiShenYiQi period, the effects of the QiShenYiQi maybe which including the lots of integration. Next, I'd like to introduce some data about QiShenYiQi purely attenuates the cardiac microvascular hyperpermeability and the endothelial damage induced by ischemia and the reperfusion. Vascular endothelial barrier integrating are primarily determined of the aquaphotomics, Cavolo, and the junction. The junction protein, including the tie junction, which including the occludin GM1, JO1, and carudin 5. And Cavolo, the major protein, is valine 1. This is very important for regulating the albumin leakage. This slide shows the transmission electron microscopy image. Showing here, comparing the similar group, the very smooth junction in the similar group in the endothelium. After ischemia reperfusion, this gap was open. The number of the Cavolo increased, which induced the water and the albumin leakage out of the microvessel. For treatment with QiShenYiQi, and which including the major integration such as AS4, AB1, AG1, R1, and the DLA, can break this open. 90 minutes after reperfusion, the carudin 5 is major junction protein. You can see here in the normal condition, the carudin 5 between the endothelium is very smooth. However, after ischemia reperfusion, the caveolin 5 was down-regulating and broken, which induced albumin and water leakage. For treatment with QiShenYiQi and the major integration can prevent this broken. This slide shows the albumin leakage. Our group detect this image by the ICT camera. In the normal condition, albumin not leakage from the microvascular. However, after ischemia reperfusion, the albumin out from microvascular leakage in myocardial and the venule. Our treatment with QiShenYiQi inhibited this leakage. Scanner electron microscopy, so the ischemia reperfusion induced damage, injury of the capillary, comprised the similar group. However, for treatment with QiShenYiQi and another major integration can prevent this injury. Collagen is the major compound of the maintain-based membrane integrity. Ischemia reperfusion comprised the similar group. This collagen was degradation. Treatment with QiShenYiQi and the DLA inhibited this degradation. The collagen 4 is major protein of the based membrane. We can see here, comparing the similar group, after ischemia reperfusion, collagen 4 was broken, which not only induced albumin leakage, maybe induced hemorrhage after reperfusion. For treatment with CP, QiShenYiQi and the DLA prevent this injury. Action is now to link to transmembrane protein of tight junction via JO1 and maintain the endothelial barrier intact, which is, however, comparing the similar group after hypoxia and reoxygenation, the affecting was broken. Disrupt the degranulation for treatment with QiShenYiQi and the tonifin-Qi integration, such as AIS4, IB1, IG1, can prevent this change. On the other hand, DLA cannot prevent this change. Hypoxia and reoxygenation induced the ATP contents decrease and the AMP contents increase. For treatment with QiShenYiQi and major tonifin-Qi increase, such as AS4, RB1, R1, can prevent this change. However, DLA not fixed. The AMA increase after reperfusion was prevented by QiShenYiQi and all of the tonifin-Qi integration, however, not DLA. Western blot analysis also suggests that colludin 5 and occludin was decreased after reperfusion. For treatment with QiShenYiQi, AS4, RB1 can prevent this decrease. On the other hand, VE catechin phosphorylation was increased after reperfusion. Treatment with QiShenYiQi and all of the integration can prevent this change. Circ is upstream signal pathway has been now to regulating endothelial permeability where modulating the caveolin 1 activity. We can see here, circ expression and the phosphorylation was increased. And the caveolin expression and the phosphorylation also was increased after reperfusion. For treatment with QiShenYiQi and all of the disintegration inhibited this increased. ROC A and the ROC is very important pathway which regulating the virus cellular function, including MLC phosphorylation. After ischemia reperfusion, ROC and ROC1 and MLC phosphorylation was increased for treatment with QiShenYiQi, and this major integration of the tonifenchi, not DLA, can inhibit this change. Hypoxia and reoxygenation lead to increase of the expression about MMP2 and LP9 for treatment with QiShenYiQi, particularly treatment with DLA inhibited this increased. In summary, ischemia reperfusion induced ROC and ROC signaling pathway increase, which inhibits ATP5 expression, induced ATP cannot produce the ATP. On the other hand, after ischemia reperfusion, the complex 1 and the subunit of the complex 1 and the complex 2 downregulating, which cannot trans to selection, induced physiological production, induced apoptosis. On the other hand, ischemia reperfusion induced the circ expression and the phosphorylation increase, which induced tie junction open and VE cadherin molecular open. And after ischemia reperfusion induced MMP2 and the 9 activity, which induced basal membrane injury. However, treatment with QiShenYiQi broke this change because the DLA, the major activity integration of the QiShenYiQi can inhibit the MM2 and the MM2-9, prevents the basal membrane injury. And on the other hand, all of the integration for tonifenchi can inhibit the ROC and the ROC pathway upregulate ATP5, the promotion ATP production, which can help the assemble to acting can control tie junction, which automatically inhibit the water and the albumin leakage after ischemia and reperfusion. This work was supported by production of the new medicine, production of the administration of the science and technology of China and the National Nature Science Foundation of the China. The Dr. He, Dr. Yan, and Dr. Cui will perform this study. Thank you very much.
Thank you, Professor Han, and we're ready to take questions from the audience. Any questions? Okay, while we're getting ready, I would like to begin. So you have presented a lot of data, and in most of the results, we see that you have inquired into pre-treatment with the QiShenYiQi. So what would be the recommended pre-treatment time in order to achieve measurable effects? How, before anything comes up, we should apply the pill?
Yeah, pre-treatment with the QiShenYiQi in the 2 hours before the ischemia. In the clinic, if the infection can trick this Chinese medicine, after then go to the hospital, maybe benefit.
Are the dosages of pre-treatment and like therapy different?
Yeah, not before the post-treatment with this new drug. However, our group has been demonstrations both the treatment from 3 hours after reperfusion can prevent the cardiac fibrosis. Go to the fibrosis. Okay.
So it can reverse the
Okay.
damage. Okay, that's very nice. Okay, any questions from the audience? We'll maybe we can do that later. Again, I would like to ask you to welcome to thank Professor Han again.
Thank you.
And this concludes.